Welcome to this presentation on adults with exstrophy, presented by Misty Foster with the Association for the Bladder Exstrophy Community, or ABEC. A little bit about myself. I am a nurse with spina bifida and collateral exstrophy. I'm a foster care alumni, which means at the age of 5, I was orphaned and grew up in the foster care system until I aged out at age 18. I attended NCP College of Nursing and graduated in 2009. I attended Skyline College, where I got my Associate of Science and graduated magna cum laude in 2015. I attended Notre Dame de Namur University, where I got my Bachelor of Science degree and graduated summa cum laude in 2015. I attended San Jose State University, where I earned my Master of Public Health degree in 2018. I earned my Certified Health Education Specialist credential in 2020. Currently, I'm attending Ohlone College's LVN to RN Advanced Placement Program, which is still in progress, and I expect to graduate by December 2022. I've been an ABC Advisory Board member and Communications Manager part-time. I've worked with the ABC intermittently since 2009 by speaking at international and local conferences, creating numerous presentations, videos, and articles. I have over 16 years of extensive, well-rounded experience in the healthcare industry. I worked as a nurse at the VA Palo Alto healthcare system for 7 years before I left to finish school. I'm currently working as a school nurse in Menlo Park, and I live in the San Francisco Bay Area. Transitional care goals and challenges. Exstrophy for many years was treated primarily in the pediatric setting because its onset is at birth with serial surgeries and procedures from birth to young adulthood depending on the severity. Pediatric urologists oftentimes follow adult patient care due to lack of competent or experienced adult urologists. Most adult urologists deal with urinary conditions that arise in adulthood, not childhood onset. They may not be familiar with your surgical history, diversions, or specialty procedures. If the pediatric urologist has a trusted colleague they can refer you to, you can transition your care from the children's hospital to the adult hospital successfully. Some hospitals have transitional care programs to help with this process. Some exstrophy cases are more complex than others. Some may not be able to have a successful transition, and many need to stay with a pediatric urologist. Adulthood issues pediatric urologists don't typically encounter but may need addressing in adult exstrophy care are erectile dysfunction, menstrual irregularities, pregnancies with urinary diversions or ostomies, and pelvic prolapse after a pregnancy. Primary care for adults with exstrophy. Primary care is important. Exstrophy isn't all that needs careful monitoring. Regular health screenings annually are needed for optimal lifelong health. For example, wellness checks, preventative vaccinations, diabetes screens, blood pressure checks, weight management and healthy diets, cancer screenings, pap smears, mammograms, prostate exams, colonoscopies, routine ultrasounds such as KUBs, yearly bladder cancer checks or cystoscopies, stoma and ostomy clinic visits for stoma maintenance, eye exams, and dental visits, for example. Aging uniquely for adults with exstrophy. In previous generations prior to the late 80s and early 90s, older age considerations for exstrophy were not routinely addressed. This is a new field for specialty urologists, caring for an elderly generation with medically complex childhood onset conditions. Considerations are things like metrophenol for other urinary diversions aging with you, maintenance, and sometimes reconstruction. Considerations for bowel diversions or ostomies aging with you, looking for polyps, bleeding, prolapse, good appliance fit for a changing body type, and thinning skin. Considerations for increased cancer risks, such as bladder or gastrointestinal, due to lifestyle choices, genetics, anastomosis, or a surgical connection between two tissues of unrelated organs, also known as augmentations, and long-term use of certain medications. Augmentations are often used to make your bladder bigger using bowel tissue. Considerations for kidney care, long-term care in older exstrophy populations. Kidney clearance, infections, stones, dialysis, or transplants depending on lifelong kidney maintenance care, catheterizing or ostomy care such as a nephrostomy or urostomy, and effects of long-term medications. There is a picture on the top right of Tom Flood. He's the eldest known living senior with exstrophy from Australia. Also from Australia is Janet Rankin, a prominent ABEC member and senior with exstrophy. Relationships for adults with exstrophy. Exstrophy is not a barrier to meaningful relationships. You can date, get married, and have long-term partnerships just like everybody else. Fertility and sexual function appearance or concerns can arise, so see your specialty urologist or gynecologist for help with these concerns. Some surgical cosmetic procedures can be done, or reconstruction to improve sexual function. Counseling can help too with self-acceptance of perceived bodily differences. Learning how, when, and where to disclose your unique variant of exstrophy is your choice. If you are anxious or unsure about this, exstrophy peer-to-peer support can help, as well as speaking with a counselor. No matter if disabled or not, a relationship should be free from abuse. Physical, mental, or emotional abuse is never okay. Your self-worth is important. Do not feel forced to stay in a relationship that is harmful to you just because you are disabled and don't want to be alone. Your self-worth, self-respect, safety, and security matter too. Stand up for yourself and seek help if you find yourself in an abusive relationship or are being taken advantage of by someone you trust. Good social skills and boundaries, very important. Know the difference between stalking, harassment, and personal boundaries. It's okay to say no, to ask someone to stop, and enforce your personal boundaries. This includes phone call frequency, texting frequency or content, email or direct message frequency or content, and personal interaction frequency, touching, or unwelcome contact. Coercion or blackmail of personal health information or photos is unacceptable and should be reported to the authorities. Healthy coping for adults with exstrophy. Chronic conditions, including bladder exstrophy, cloacal exstrophy, cloaca, or spina bifida, are stressful at any age. Learning effective coping mechanisms to deal with added stressors and or anxiety regarding medical procedures, self-management of health appliances or tools such as catheters, ostomy pouches, braces, etc. Knowing where you can go and who you can turn to when overwhelmed or need help, such as counselors, EAPs in the workplace, urology social workers, therapists, family members, trusted friends, or religious leaders. Know and recognize signs or symptoms of depression and seek help. Find hobbies or activities that you enjoy. Pets can help too as sources of unconditional love and are non-judgmental sources of comfort. Emotional support animals are a great asset. Any self-harm thoughts or feelings should be reported. Don't hold them in. A trusted family member, friend, or counselor can help you. You are not alone. Lifestyle factors for adults with exstrophy. Adults with exstrophy face similar normal life stressors, which are non-medical, as their non-exstrophy peers do. Maladaptive coping mechanisms, such as smoking, drinking alcohol, or illicit drug use, damage the kidneys, heart, and brain over time. They also predispose you to other detrimental conditions such as increased cancer risks, liver and gastrointestinal damage or cancers, and dangerous substance versus prescription drug interactions. Inactivity, which is a lack of moderate exercise, can predispose you to obesity, poor circulation, lowered immunity, pressure sores, and venous stasis ulcers, which can occur when blood pools with the potential clotting in your lower extremities. Low impact activities such as walking, swimming, yoga, etc. are very beneficial to your overall well-being. Better overall health often equates to better exstrophy management over the lifespan. Inactivity or sedentary lifestyles can make surgeries more risky, wound healing more slow, and complications more likely. Diet. Diet is very individualized. Depending on bowel available after harvesting for bladder augmentation and or bowel ostomies, malabsorption of needed nutrients can be an issue. Some with exstrophy already have short gut syndrome, which reduces nutritional absorption of essential vitamins, minerals, fats, and other needed nutrients by the body. Discuss with your specialist and primary care doctor your specific needs. Malabsorption. Malabsorption can affect your body's acid-base balance and metabolism. Common short gut malabsorption issues are low B12, not enough gut to produce it, excess fluid volume loss through ostomies, electrolyte imbalances, osteoporosis, kidney stones, gallstones, and high fiber intolerances. Finding the right diet and supplemental nutrition balance that is right for you takes time. Your primary care doctor may refer you to a nutritionist for help with this. Good nutrition is essential for surgical wound recovery, infections such as UTI and kidney infection recovery, and overall health. Hydration. Hydration is essential. Adequate hydration keeps your bladder and kidneys in optimal health as much as possible with your exstrophy. It helps prevent stone formation, keeps your tissues and organs hydrated, and is needed for all bodily functions. Excessive sugary sweet drinks or caffeinated drinks can predispose you to diabetes or excess fluid loss through the diuretic effect of caffeine that messes with your electrolytes, especially potassium and sodium. Ostomies or diversions. Management of bowel and bladder elimination varies person to person with exstrophy. Age is a factor. Older adults may have older methods like uterosigmoid ostomies, middle-aged adults may have urostomies, and younger adults might have Mitrophanoffs or other newer procedures. Availability of augmentation donor tissue is a factor. Some ostomies or diversions can't be taken down or reversed due to not enough tissue left for reconstruction. Pouch systems can be open or closed depending on type of ostomy and output. Ostomies and diversions can be permanent or temporary. In the bottom right is a Mitrophanoff or catheterizable continent urological stoma. Bottom left, you can see different bowel ostomies, colostomy, ileostomy, or a urinary urostomy. On the top left, you can see an example of a uterosigmoid ostomy. In the middle, you can see different versions of pouches and coverings. Latex allergy and precautions. In the late 1980s to early 1990s, latex allergy prevalence was increasing in both patients and healthcare practitioners. Contact dermatitis reactions, which are itchy rashes and hives on your skin, and then progressive anaphylaxis reactions in both populations led to a gradual phase out of latex in most healthcare settings. Latex proteins from natural rubber can be seen as antigens or invasive by our immune systems. Repeated exposures can lead to IgE antibodies production in response to the developing allergy. Certain foods have similar proteins to latex and can also trigger the same IgE latex antibodies response by the immune system. This can include bananas, avocados, and tomatoes, for example. Continuous latex exposure with the IgE antibody responses can lead to anaphylaxis, which is a life-threatening allergic reaction and medical emergency. The most affected populations for latex allergies and latex precautions are those with spina bifida, congenital urogenital anomalies such as exstrophy, spinal cord injuries, nurses, doctors, hairdressers, EMT first responders, and firefighters. These populations have the most latex exposures due to gloves and medical equipment use. Latex allergy is a diagnosable condition. Once you know you have it, make sure it is on all of your records. Latex allergy precautions should be in place for you in the emergency room, clinic, operating room, school, home, and your workplace. Keep an EpiPen, which is an epinephrine autoinjector, on you at all times. Make sure others, such as your family, friends, co-workers, know of your allergy and where to get your EpiPen for you in an emergency. Consider a medical alert bracelet or necklace to alert first responders in an emergency to use latex precautions for you. Update your smartphone emergency info settings too if you have one. Avoid balloons, latex gloves, latex condoms, latex rubber balls, reusable latex dishwashing gloves, yellow medication vial stoppers, and Bunsen burner yellow tubes. Learn what in your common environment is latex and how to avoid it. Insurance. Exstrophy lifelong care can be very costly. Often, children's health care needs are fully covered, but adult health care is not. Health care can come from countrywide plans, state or regional plans, or through an employer, or privately purchased health care plans, personal health care plans. Insurance plans and policies vary from country to country. Look at what is offered and or required in your country of residence. Try to choose plans that offer access to specialty providers, such as urology, GI, orthopedics, nephrology, etc. Try to choose plans that cover specialty maintenance medications and treatment costs. Try to choose plans that cover surgery, anesthesia, and post-op care, not just emergency or outpatient clinical care. Some countries and states have supplemental insurance plans that pay for costs not covered by national health care plans. In the United States, this is Medicare. Try to choose plans that cover monthly specialty supplies, such as your catheters, ostomy pouches, flushes, syringes, sterile saline, pads, absorbent underwear, etc. When transitioning to adult care for the first time, sometimes urology clinics have a urology social worker who can help you make smart insurance choices that allow you to continue with access to the clinic's care and show you the insurance options available. Medical supplies. Supplies that work for you as a child might no longer be available as adults because manufacturer changes or medical supply company changes. Sometimes you outgrow ostomy supplies and need a new fitting. Mitrophanoss or other diversions can develop scar tissue or strictures over time, and different types of catheters like Coude catheters or smaller sizes might be needed. Prescriptions are needed for these supplies. Finding a specialty provider to continue prescribing these for you is important. Learning to self-manage your personal medical supplies and procurement is a big part of transitioning to adulthood. Keep emergency supplies as a backup in your purse, backpack, car, briefcase, gym bag, etc., so you never find yourself in an accident or bathroom situation with no supplies to take care of your own health needs. Careers for adults with exstrophy. Exstrophy is not a barrier to gainful employment or fulfilling careers. There are many working adult professionals with exstrophy. Some real-life example careers of adults with exstrophy are nurses, doctors, teachers, engineers, missionaries, surgical techs, medical assistants, Uber drivers, administrators, CEOs, aerial acrobats, and photographers. Workplace self-disclosure of a disability. It is beneficial to privately disclose to HR your medical condition as it pertains to your work. Total history isn't needed, just what pertains to your work. Not disclosing can lead to unintentional write-ups or disciplinary action for frequent illnesses or appointments or frequent bathroom use. Some jobs require pre-employment physicals. Be honest about your limitations and your strengths, not just your disabilities. In order to get accommodations in the workplace, you have to first disclose that you have a disability. They don't need to know your total medical history, just what pertains to your job and why you need accommodations for certain things. Reasonable workplace accommodation requests: unlimited bathroom access, FMLA, which is medical leave for extended hospitalizations, illnesses, or surgeries, latex allergies and precautions, uniform accommodations for appliances such as ostomies as needed, private drawer or locker for medical supplies, access to hydration and medication as needed are a few examples. Travel for adults with exstrophy. Always pack and keep on your person or your carry-on your medications, appliances, and supplies. If luggage gets lost, it's imperative you have your supplies with you. If you have a metrophenol and are traveling overseas, consider a bladder tap kit from your urologist in the event you are at risk from a bladder rupture due to metrophenol or other diversion stenosis. This is where you can't get your catheter in. Foreign hospitals may be unfamiliar with how to help you or not have the right supplies on hand. Have a travel letter for TSA from your doctors. List all liquid medications or supplies, sharp supplies such as scissors and needles, catheter or ostomy supplies medically necessary for you so they don't get confiscated. List contact information on official letterhead best for the medical letter for your medical specialty providers, urologists, etc., for TSA or police officer verification. Bladder exstrophy and cloacal exstrophy newsmakers. Emily and Cameron Coleman, both with exstrophy. They are famous for their childhood bond and adult romance story and now have a daughter of their own. Corey Conacher is an National Hockey League or NHL hockey player with exstrophy and diabetes from Ontario, Canada. Rowan Lester is a professional golfer with exstrophy in Dublin, Ireland. Bilal Sharif is a 7-year-old brick factory worker who was born with a club foot and bladder exstrophy in Afghanistan. He was brought to the United States for care by U.S. Army Major Glenn Batchlinger. He is now in his teens with dreams of becoming a doctor. Lauren Gaudette has spina bifida and cloacal exstrophy, and she's now a football coach in Massachusetts, United States. Adult exstrophy role models. There are so many, it's hard to choose. Here's a few notable ones. Christine Lupton, aka the Pride of Britain from Scotland, United Kingdom. Paul Carenza, United Kingdom comedian and BBC personality. He also worked on Top Gear. Enrique Escajeda. He's an aerialist and acrobat from California, USA. Dilara Arslan is a scientist from Istanbul, Turkey. Joe Halliday, gender rights and exstrophy activist from the United Kingdom. And last but not least, Tom Exler, longtime ABC leadership member, advocate, and ostomy outreach specialist. He's a motivational speaker, blogger, and blog writer. Thank you for your time. I hope you enjoyed this presentation. Bye.